So welcome everybody to the Greene County Leaders November session on leadership and COVID-19. Welcome to those of you who are Greene County Leader alumni and join in for a taste of Greene County Leaders if you are not an alumni. To everybody joining us now for this session and everybody tuning in later for the recording of this session, we're so glad to be here with you. I'm going to introduce myself. I'm Victoria Solomon, Community Development Educator with Extension Greene County, and Kara Carper, the Executive Director with Greene County Development Corporation. Also, special recognition to Greene County Leader Board members. I know we have a number joining in on the session today. Before we get started, I do want to recognize our veterans. It is Veterans Day, and huge thank you to all who are serving now, and who have served in the past. Just thank you. I'm going to do a quick intro to Zoom if you have not used Zoom before. At the bottom of your screen on the left-hand side, there is a mute unmute icon. When not talking, if you can go ahead and mute. If you're on a phone, *6 will mute unmute you. Next to that, there's a video, start-stop video icon. If it is possible with your internet connection to turn on video, that is fantastic. If that doesn't work, we understand that there are internet issues. If you're eating, if you have kids, your pets joining, no judgment at all. It's fantastic to see faces. If you look further along the bottom, there's an icon for chat, and in the chat, let's do some quick introductions so you can get to know each other a little bit. Please put your name, where you work, what organization you're involved with. I'm going to put mine in really quickly. And the chat is going to be a function that we can use later for questions as well. So I know we have some new folks joining. Special welcome to you. I want to share a quick introduction of Greene County Leaders. The purpose of the program is to help build leadership skills, to deepen understanding of community issues here in Greene County communities, and provide opportunities to create and expand community networks. This program is possible through a partnership between UW-Madison Division of Extension Greene County and Greene County Development Corporation, with strong support from lots of businesses and organizations across Greene County. This year, we're doing a session every month. It is virtual and free, open to anyone who lives or works in Greene County. Today, we're going to be covering COVID-19 in Greene County. However people feel about this, we are all in this together. The conversation will be civil and based on science and data. The current rates are unfortunately very high. In some ways, the solutions are simple and at the same time very difficult. It's kind of like running, right? It may be one foot in front of the other, and at the same time, a marathon is really hard, right? But we're in this together, and we can get through this together. I'm confident about that. We hope to be able to help decrease the rates so that we can have a healthy community and healthy economy. So today, we're going to kick things off with a piece about gratitude. We're going to hear from leaders on COVID-19 in Greene County, and we're going to explore a bit about managing pandemic fatigue. So I want to do a quick refresher on some of the things that we've covered in our September and October sessions, if you're joining for the first time. In September, we talked about circle of influence and circle of concern, and this is sort of a way to remember to stay focused on what we have control or influence over. Then we learned more about opportunities to support communities in Greene County, specifically local businesses and nonprofits. In October, we talked about being grounded as a way to help manage a lot of what's going on and keep things civil. We also learned about issues and opportunities at the local level of government in Greene County, as well as advice on communicating effectively and civilly with local elected officials. Today, to kick things off, we're going to take a couple minutes to sort of pause and be grounded in gratitude. That's always a great thing to do, always great during this time of year, and I think this year in particular. And with that, I'm going to hand it over to Kara.
Thanks, Victoria. Hi, I'm Kara Carper. I work at Greene County Development Corporation. And normally in November sessions, I get to teach a little presentation about gratitude. And I use the term teach very loosely because usually I learn more from our Greene County leaders that I bring to the table. So hopefully I bring something to the table, but I know I'll take away more than I give out. So we talk about why gratitude is good. And if you Google, I've been studying and practicing gratitude for a number of years. And if you just Google the terms gratitude and happiness, you'll come up with all kinds of information, or better yet, go to the Greater Good Science Center, and I'll put that in the chat so that you can find that, and also at the notes that we send out later. You'll find all kinds of great research-based information on why gratitude is good for our bodies, our minds, and our relationships. I really like the Greater Science Center for that kind of research-based information. The research really encourages us to systematically cultivate gratitude through things like gratitude journals and other gratitude practices. So a gratitude journal is basically where you just keep track every day of things that you are thankful for. Research shows that people who practice gratitude, and again, it's a practice. Sometimes we go away from it and then we come back. I encourage you to come back to gratitude because it's a wonderful practice. And those who do practice gratitude have a host of benefits: physical, psychological, and social. So they have stronger immune systems. They tend to have lower blood pressures. They have better sleep. Psychologically, they have more positive emotions, more joy and pleasure, and more optimism and happiness. And finally, socially, people who practice gratitude tend to be more helpful, generous, and compassionate. They tend to be more forgiving, more outgoing, and they tend to feel less lonely and isolated. So when you look at especially those social benefits during a pandemic, it's just so important because gratitude is a social emotion. It requires us to see and to think about how we've been supported by others and affirmed by those people. So gratitude really heals and it empowers. So let's just talk about 4 reasons. There's lots of reasons, but 4 ways that gratitude is good. Gratitude allows us to celebrate the present. So if you were at the Greene County Leaders Session last month, you heard Susan Anderson talk about how mindfulness and being in the moment is so important. And gratitude helps you be in the moment because when you notice the positives, that magnifies the pleasures that you get in life. So again, it helps you be in the moment. You notice right now how thankful I am for something. Gratitude also, number 2, blocks toxic negative emotions such as envy, resentment, and regret, which are emotions that really destroy our happiness, which makes sense. You can't, if you're grateful, you can't resent someone for having something that you don't have. Grateful people, number 3, grateful people are more stress resistant. And finally, number 4, grateful people have a higher sense of self-worth. So that's because you're realizing that other people have seen value in you, and that can really transform the way that you see yourself. So during our Greene County Leaders Sessions in November, when we have everybody together, we normally talk about gratitude practices and what people do in their homes and with their work colleagues to practice gratitude. And again, that's where I always learn more than I give, because, for example, last year, one of our Greene County leaders raised her hand and she said, I wrote a book on gratitude. So I don't know if you can see this. 30 Days of Thanks, written by our very own Gina Butson. She wrote the book on gratitude, and I'm trying to teach it. But anyway, the book is wonderful. And Gina Butson works for Mosier and Associates, and I highly encourage you to read this book. It's great. But again, this is the beauty of Greene County, because we have people here who have written books on gratitude. It's just delightful. So often one of my favorite gratitude practices, which is something you can do with your families, you can do it with smaller kids, you can do it with your coworkers, is to make a gratitude tree. So I bring along sticky notes and you can just use regular sticky notes, or I happen to have some that are shaped like leaves, and everybody writes down things that they are thankful for on their leaves. And then they stick it to a beautifully drawn tree that I drew, not beautifully, on a flip chart. And so we end up with this beautiful leaf-covered tree with things that people are thankful for. So I want to do that with this group. So if you would just take a few seconds, and it's just going to be a few seconds, to write in your chat box things that you are grateful for. And you can just multiple write, whatever, but just write things that you are grateful for in your chat box. Go. This is
Fun.
really nice. I'm really liking this. So finish up your thoughts. But I want to direct your attention back here because I want you to take your gratitude to the next level. So I encourage you to do this gratitude practice and to use a gratitude practice. But I really want to let's step it up a notch this year. Let's step up our gratitude practice. So a couple of years ago, I came across this quote and it just struck me. It says, "Gratitude dies when you think it, but don't say it." I'll say it again. Gratitude dies when you think it, but don't say it. So I put that on a sticky note and I actually taped it to my computer. I never really thought about that. So many of the things that I saw you write in your chat box, some of those things that you're thankful for are things, but some of those things that you're grateful for are people. And so you can really if you think about it, if you can really say things out loud and how important that is, because you are pouring energy into others if you say out loud what you're grateful for. So I encourage you again to say it out loud and say what you're grateful for. So stretch yourself. This does not come really easily to all people. It's much easier to say, I'm thankful for, I'm grateful for, but to say, for example, Gina, who wrote this book, Gina, thank you, Gina. Your book was a joy to read. Thank you for helping me to be a better teacher when speaking about gratitude. Your book helped me to be grateful about little things and big things. So again, I'm thankful. I'm supercharging my gratitude. It's called aspirational gratitude. So can you supercharge your gratitude? And again, this is not easy. It's again, one of those things that are our practice. Often practices aren't easy. That's why we practice them. And so let me just give you 4 tips on being grateful. So instead of being grateful for, you're going to be grateful to. So 4 things on being grateful to. Use the person's name at the beginning of the sentence. Thank you, Gina. Notice their quality work or notice a quality about them. Your book was a joy to read. Notice the impact of their work or the impact that they had on you. You helped me to be a better teacher and more grateful. And then notice some character qualities, perhaps. Your book helped me to be grateful about little things and big things. So directly addressing that gratitude humbles you. And it's just, again, sometimes it doesn't come naturally, but I encourage you to challenge yourself to step it up and bring your gratitude to not just regular gratitude, but to aspirational gratitude, where you're grateful, not only grateful for, but grateful to. All right, so with that, I'm going to turn it over. Think about that and be grateful. I'm going to turn it over. We have a couple of very, very busy people who we're so thankful to have. We have Jane Curran-Miley, who is the president of Monroe Clinic, which is part of SSM Health. And we also have Rowan Warden, who is our Greene County Health Department director and our health officer. And they're going to be talking about something that I think we can be grateful for, and we can think about how we can be grateful for and grateful to and grateful for, but talking about COVID and how our community can get ahead of this. So we're going to have first, I think Jane's going to speak, and then Rowan's going to speak.
Just because there's already a
if you have questions, we've got somebody with a mic open. If you have questions, please type them in the chat box, and we'll watch the chat box and make sure that Jane and Rowan get those questions, but we're going to take questions at the end. So please, if you have questions for Jane and Rowan, please type them in the chat box and we'll keep track of those. So with that, I'll turn it over to Jane Curran-Miley, again, president of Monroe Clinic here in Monroe.
Well, first question is, can you see my screen? Good. Okay. Really want to talk about what we all need to do to reduce the spread within Greene County of COVID. And this graph is just a very simple understanding of what's going on right now. You know, we really did very well in the early part of the season, and when COVID started back in March, you can see we are kind of fairly flatlined as we went along. We had a little peak in September. We all kind of assumed that was with kids going back to school and colleges, but all of a sudden we are climbing through the roof in terms of our numbers. And this is, I mean, this is pretty significant when you look at what the change was. I would assume at this point, we all know someone who's had COVID, and the impacts have been minimal to severe, including death. Excuse me. Our current situation, it is spreading rapidly. We're not seeing ourselves taper off at all. Estimates are anywhere from 20 to 40% of the people with COVID aren't showing symptoms. So it's not just because you feel well today that, oh, so I don't need to mask or I don't need to do this. You may be spreading it without knowing it because you're not exhibiting symptoms. Or you could be the next person to get ill because the person next to you isn't taking the precautions they need to do. While our census is fluctuating daily here at Monroe Clinic, 2 weeks ago, we were absolutely full. There was not an open bed in our facility, which meant that if someone came in, we would have to have transferred them elsewhere if another bed was even available elsewhere. Last night, we had transfers in as far away from Sauk to our facility here because of Madison beds being full. Today, we are again close to capacity. I think I have one open bed as it is right now. I'm hoping to discharge some patients this afternoon. That'll give us a little bit more capacity coming up. But this starts telling you where we have some limits and we need to control the spread so that we can make sure we're treating everyone who needs care. Skilled nursing facilities are trying very hard to protect our most vulnerable population by they're not letting visitors in. They're not letting people go out on just routine visits and stuff, because this is our hardest hit population. When you look at the statistics right now, it's about, and Roanne may want to correct me on the numbers, but it's about 50 to 60% of the people 55 and older are the ones who've had COVID and had it most severely. So the skilled nursing facility level is huge, but it also, because they're getting full and based on regulations, if they have an outbreak in their facility, they can't admit additional patients. Well, where do those patients go? They're stuck in the hospital, which then fills up hospital beds, which means the hospital then doesn't have the ability to take on new patients. So while we're trying to do the right things, it does cause some issues. The state has opened up an alternate care facility in the Milwaukee area. They have a few patients there. It's not the ideal, but it is one of the options as we get full of where we at least have a place that we can get people to receive the care that they need. What can you do to stop the spread? I mean, you all know this, you've heard it over and over. But if you think about wearing a mask, you go, well, mine's just a little mask, it doesn't make a difference. It decreases the viral spread, it decreases your risk of getting the virus. You may still get it, but you get it in a lesser quantity. Performing proper hand hygiene. In my household, everyone is singing the ABC song, and that's how long you should be washing your hands. Social distancing of at least 6 feet. Disinfecting most surfaces touched. When you go to sit down at a table, are you wiping it off first? When you get finished with the table, are you wiping it off so it's clean for the next person? And as always, we've been really talking about avoiding large gatherings is really critical. These techniques work though. This is really important. Proper wearing a mask. I see a lot of people who have it either dangling from their ear or under their chin. That doesn't help. Under your nose doesn't help. It really needs to be over your nose and mouth and fitting properly. What we've started doing is putting out some workstation guidelines, reminding everyone, maintain the 6 feet, wear your mask, sanitize, as we just talked about, the frequent hand hygiene. Again, the ABC song works. Avoid touching your face. I never had realized how often my hands were up in my own face. And so, it's like, okay, you got to stop those. Some of these are just habits we've had forever, and you don't think about the impact that has. But help your coworkers, remind them, hey, can you step back? Or, excuse me, I need to pass. we kind of are doing this dance we find at work. So if someone wants to walk down a hallway, people are stepping aside and stepping into doorways to let people get past, to assure that safe distance. And it's really important to make that a normal part of your cultures at work. At Monroe Clinic, we have a gating status process that we go through. Right now, we partnered with SSM Health to make sure that we're doing this for our clinical and our non-clinical. We have the same status for our hospital and our clinics. This helps us make sure that we're able to continue to provide safe care to our community while minimizing the risk to patients, visitors, and staff. The things we take into this is we look at bed availability, sufficient PPE, personal protective equipment, number of COVID patients in the hospital, percentage of positive rates in the community, and the availability of testing supplies. Oftentimes we have limits of how many tests are available to us. So we really work in great partnership with Roanne and her team, making sure we're doing what's necessary, but we each have different access to supplies that we have to use. Right now, Monroe Clinic is in red. We're primarily in red because of the escalation within the community and right now our bed capacity. We don't revisit that except for every 14 days. So our next revisiting of this status will be November 19th. This impacts visitor restrictions. It closes or limits departments. It decreases your access to our building. It closes such things as the cafeteria to the public, our gift shop. It restricts in-person meeting. This morning, I'm sitting in offices next to 4 different people, and we're all doing our meeting via Teams. We're not in person. Even though we very easily could have gone down the hall, we probably could have kept 6 feet apart, but this is the better way to do it. Help us, this precautions work. Monroe Clinic employees have gotten in COVID, but not by exposure to anything at work. They've gotten it in the community. Now, I do have to change that slightly today, is we have one employee who got it at work, but that's because they ate in close proximity to another employee without masks on, and that proximity was close enough, it wasn't the 6 feet apart, that caused them to get the virus. Even those who are caring directly for our COVID patients have not gotten it through those interactions. Again, the hand hygiene, the masking, the proper disinfecting of surfaces, the masking make a huge difference. Your commitment to proper social distance, mask, great hand hygiene, and disinfecting, you can make that difference. As a healthcare organization, our staff and providers put their lives on the line every day with what they're facing, with the patients coming in, the demands, and they're trying to do everything they can to make sure that you're being cared for. I wanted to pop up a real quick YouTube video, so I'm going to hope that this works quickly for you, that really speaks to the impact. And if you want more information, we do have it on the Monroe Clinic.
Obama and Biden families are about to leave office.
Oh, excuse me.
8 years, and so Sandra Sobrai Westfall.
Our website has it available, has information that we update daily, and feel free to go on out there and learn.
Jane, we have a few questions.
Sure.
So the first question was more of a statement. It was someone wanted to thank you for letting them know how far that people are being transported to get to open beds. They found that eye-opening and interesting.
Good.
The next question was a question about any data on glasses or eye coverings in addition to the nose and the mouth covering.
We have, for our staff who are coming in contact with patients who are at risk every day, We do have them wearing eye covering. Again, one, it keeps your hands away from your face, rubbing your eyes, those kind of things. It decreases the chance of spread. They are finding that is effective, but it's not one of the CDC, everyone needs to be wearing the plastic shields or glasses, but they are finding the effectiveness in that. So all of our patient-facing staff either have plexiglass or are wearing glasses these days.
And then another question about rotating staff. Are you guys doing that? Do you recommend it? Is there any data around that, if it's being helpful?
We'd like to clarify what you mean in terms of rotating staff. Rotating staff who are caring for the COVID patients, or?
It says not having a full staff in every day to minimize risk. This is someone from the village board.
We're working very much, anyone who has the ability to work from home, we are encouraging them to do so. Again, that allows them the social distancing. It opens up the space within the organization to allow others to move around more freely. But a lot of our work has to be done in person. But we have asked a lot of people to work from home at this point. And we're actually finding them more productive.
Well, I want to thank you for taking the time, Jane, to meet with us. We know you're very busy. Your team's very busy, so thank you very much for taking your time. I think Roanne's going to take over now.
She is. Thank you, everyone.
Good afternoon. This is Roanne. I'm Greene County Public Health Director, and so pleased to be here with you all. So I wanted to just thank Jane for sharing, and I'll hopefully I'm not duplicating any of that information, but emphasizing the and stressing that important information that she's shared. So it's really the time has come and we need to turn things around, and that's why you see my title slide as it is turnaround time here. If you could advance the slide. So this is a graph that's put out by Wisconsin Department of Health Services that depicts the disease activity level. It's just one of the indicators that in public health, that's, oops, can you go back? Showing all of the counties, 72 in Wisconsin, are considered and classified at a very high level of disease activity level. So, and this is based on 2 weeks of data from October 21st through November 3rd, which this chart will be updated then every week at Wednesday afternoon. So you'll see a new chart come out. But as you can see, it's very widespread, and every county is being greatly impacted in Wisconsin. Out of the nation, Wisconsin is one of the leading hotspots at either number 3 or 4 with the number of new cases per our population. So this actual website is linked on Greene County Public Health website, and it's an excellent resource for you to see where we're falling. But we've been at a very high disease activity level now for over a month here in Greene County. Can you advance the slide? Oh, there you go. This is just a screenshot of our Greene County Public Health coronavirus dashboard. In there we list the data is based off of the last 2 weeks. So currently over the last 2 weeks of test results that have come in on Greene County residents, we're showing a 26% positivity testing. So we're up over 1,200 cases, and this is data as of yesterday. It'll be updated here this afternoon. We have currently in Greene County 177 individuals who are considered active or infectious and able to spread that we're aware of. So far during the pandemic, Greene County has seen, unfortunately, 5 of our residents pass with COVID, and we have currently 4 Greene County residents who are in the hospital at various locations throughout the area. So as Jane indicated, in public health, we track a lot of data through our disease investigations and reporting. So through the course of the start of the pandemic, you can see where our ages of individuals who are testing positive. Fortunately, at the higher age end, we've had fewer cases, and I think that goes to show that our seniors are doing I think a good job of protecting themselves, and as a community with our long-term care skilled nursing facilities, doing a good job protecting them. In the last several weeks to a month, most of our new cases have occurred in that 30 to 50, 60-year-old population, and we've seen a drop-off in our new cases actually in our children. A lot of the transmission that we're finding is due to households transmitting it amongst one another, as well as more recently, people who are out and gathering in groups that are outside of their own household. On our dashboard, we indicate more of a cumulative where our cases reside in Greene County. So you can click on that and zero in on actually a zip code level. And we also track on the tests per day. So you can click on that where the age range is. So can you advance the next slide? This is just a graph. It's a little bit more confusing, a little bit more going on. But on the left side is the average daily new confirmed cases, and that would be indicated in the blue bars. So you can see daily that we're averaging anywhere from 20 to 30 or 20 to 25 new reported cases per day. In November, and you can just see since the start how that has climbed, and even more significantly since August. And the orange line here depicts the number of average of testing that's being done on a daily basis. So we're approaching about 90 residents that are being reported tested per day. So actually, based on our number of cases, it would be we need to actually do more testing with such a high degree of infectivity and positivity. So and if you could advance the slide. As I mentioned, in public health, we collect a lot of data for surveillance, and one of our roles in public health is to investigate when there's outbreaks, and we track those at the workplace. So if we have 2 or more individuals who are tested positive within a time frame and can be linked, we would categorize that as a workplace outbreak. And you can see this bar here. Currently, we have 8 workplaces that have what we would call investigations currently going, and so far we've had and closed out 15. In our long-term care facilities, we currently have 5 outbreaks, and that outbreak will last 28 days. So it's a long time that a facility or a workplace would need to go without a new case. And so you can imagine, with the amount of activity right now, we're seeing a lot of continued open outbreaks occurring. In our educational schools or colleges, we have 2 currently that are being investigated, our group housing, and then in our healthcare. So this will also be updated this afternoon on the DHS website, but this is specific to Greene County. And thank you. And this is, we've been doing in Greene County what we call community COVID testing since early September. So we last week moved all of our testing for community testing to a Monroe location, which is located it's the actual old MTX building behind Aldi's and Taco Bell in Monroe. The address is 628 West 10.5 Street in Monroe. And we operate free community testing Mondays from 9 to 1 and Wednesdays from 2 to 6. And this was last Wednesday. The weather was really nice and the sun was setting. And then Thursdays we have testing available 9 to 1 as well. So we encourage anyone who has symptoms to reach out to their healthcare provider first and do a screening with them for testing options. And if they're a close contact, they are welcome to attend one of our Greene County community testing dates. We do ask that people register in advance, and that registration is at the Greene County Public Health .org website. It's a red button, register for testing. It's a two-step process. It can be paperless. When you do arrive, you have a QR code that's been emailed to you. If you don't happen to have an email or need assistance with that, feel free to come to the site and our testers will help you through that process. The second step in the sign up is to select a date and time so that we can somewhat regulate the flow. So far, I've been able to obtain 600 testing swabs per week from the State Emergency Operations Center. And we have not quite reached 600, but we offer these 4-hour clinics, and we are conducting anywhere from 100 to 150 swabs per 4-hour clinic time frame. Next slide. So in public health, we're also, one of the key strategies for trying to slow the spread is through contact tracing. You may have heard about that, and this is just one of the infographics that our DHS has created, encouraging anyone, if they've tested positive or if they've been a close contact, their information should be shared with a public health official when they are called. So we want everyone to answer the call and speak with one of our public health contact tracers so that we can provide them with the information that they need to keep themselves, their family, and their community safe. And it really does take the cooperation of our community for this to be effective, and to be honest with the contact tracer. All of this is confidential, so we just encourage everyone to pick up and answer that call. We will leave a message if indicating that we're with the public health. So next slide. Recently, with the holidays approaching, we wanted just to remind listeners that now is not the time to come together and gather with people outside of your immediate household as much as we want to. And it's we would, based on what we're experiencing with the high degree of transmission and the impacts of that with our healthcare systems, with our lack of, with our the bed availability and ICU availability, we're seeing crunched, and with the increasing numbers of deaths. So we would advise that people just celebrate the holidays within their own household, to avoid frequenting any restaurants or bars. Order in for pickup, and do that local shopping online with your local vendors. So keeping your circle very small at this time and avoid traveling is the best thing for you and your family and community. So if you are going to travel, which we wouldn't recommend right now, but asking to quarantine for 14 days to make sure that you're healthy, and certainly to do those things that Jane indicated that we know makes a difference and works, is to wear that mask and stay apart from one another, and to frequent hand washing. Next slide. So what, as Greene County leaders and community members, what can you do? So we've talked a lot about staying home right now. It's very important to keep your circle small, to wear that mask or that face covering, and wear it properly. We know that it does work. It makes a difference. It reduces the respiratory virus transmission, to keep apart, and to really practice hand hygiene with either sanitizer or hand washing, being diligent. Now's the time, if you haven't, to get that flu shot. We want to make sure that we're keeping our healthcare systems free of anyone that's needing to be cared for because of flu. So get that flu shot now if you haven't. And then also, if you yourselves are having any symptoms of COVID, we would advise that you go get tested, contact your healthcare provider, or sign up and visit one of our community testing sites. The other people we would advise, get tested if you've been notified that you are considered a close contact to a positive case. We'd want you to get tested so that we can really step and intervene with that cycle of transmission. There is a coalition that's Stop the Spread. It's I think been endorsed by the Wisconsin Hospital Association, the Department of Health Services, and they have some great tools, resources available. I've got that website there where you can go and download those things and share them with your employees, your coworkers, your family. And I've listed that to also have courage to speak up, maybe not necessarily speak up, but set boundaries for yourself. And if there's talk of a gathering, and maybe asking, is that a good time? And reconsider that. Asking somebody to wear a mask is having courage. So we can do this. I know we can if we pull together. Next slide. So when I say remaining hopeful with this particular slide, it's not a feeling, it's an intentional choice that we're making, because we know that these messages that we've been hearing now since the start, we know that they're effective, and that collectively we can make a difference. I don't think anyone is saying that it's not going to be easy. We know it's going to be tough, but we can and we do need to do this for our community and for ourselves, for our family. So I think now is a good time to choose that hopeful attitude. Thank you.
Couple of
And we have a couple
questions.
questions. Yep. Oh, go ahead, James.
Well, just what I saw there, a couple of the slides people referenced, the holiday guidance slide and a couple of others. Are those available on your website?
We will be putting out guidance around the holidays for people. It's not currently on our website. I think these slides will be available if I heard correctly, Victoria. However, we'll be putting out some information on our website and to the media and Facebook page.
Also, the CDC has a really nice listing of holiday ideas to keep distance. So that's a very easy reference everyone can get to.
Great.
One other question, and this could go to either of you. Wisconsin has seemingly seen more of an outbreak than other states, although we're certainly not alone. Is there any specific reason why Wisconsin has seen such a severe uptick in cases recently? given the fact that we're, somewhat of a rural state?
Oh, that's a tough one. I'm going to speak my personal opinion. I think the pandemic's been very much politicized. It's made it very difficult. People wonder, does a mask work? Does it not work? Just based on what they hear. So we've had varying levels, I think, of cooperation with these measures that we need our individuals to do at this time without a vaccine, without widely circulating. So we're doing a lot of testing. I know we've got a great testing system in our state, and I think that's also, those are just my 2 cents.
And I would agree on the masking. It's anecdotal, but I'll go into a grocery store or I'll go into like one of the hardware stores, and the number, I would say 50% of the people in the store don't have masks. They may wear it as they get in the door, and then they take it off, and you're going, oh, please. And so I'm doing everything I can to avoid them at those points, because I have to keep my employees safe here. And I do that by making sure wherever I go has it. The other thing we're starting to see a little of are some people trying to move on with life, but they're having some larger events. They're having some weddings or some gatherings, think, oh, it's just family for a social gathering, and then everyone in the family ends up getting that exposure. So there's a variety of things happening that are causing us to do it, but I also agree with the politicalization of the safety precautions.
Those were the questions that I saw.
So I do know that we have a number of questions coming in, and that I think that's fantastic. And there's so many questions. I think questions are always a good thing. I know that we have a tight schedule, and we have a number of awesome leaders who are joining today, who are super busy. So what we will do is we will keep the questions that are in the chat, and we will definitely do a follow-up. So we will respond to all the questions as a follow-up to this recorded session. And the awesome thing, if you are like me, sometimes questions come up after a session, so you can still reach out, you can still send in questions. We're all in this together, and there's no time limit for asking questions. It'll just take a little bit longer to get responses. Huge thank you to Roanne and Jane for joining us today and sharing what's going on. I know there's a lot on your plates. Huge thank you to your teams and for everything that's going on. I agree with Roanne. This is hard, and we can definitely do this together. So with that, I'd like to introduce Bob Erb. He's president and CEO of Colony Brands and a Greene County Leader alumni. Bob will be sharing his perspective on healthy community, healthy economy. Bob, thanks for joining us today.
Thanks, Victoria. Hopefully everybody can hear and see. All right. I don't have any slides to present today. I guess I just wanted to provide a little bit of perspective of what we've been doing as, obviously a large employer in the area. Just give you a little background, and I just have a few minutes, and certainly can connect with anybody that would like to after the fact with more details. So a little background. So our organization, Colony Brands, we started to take action in our operations really probably early last February, when we saw we have a global sourcing, we have a buying office in Shanghai, China. So we saw up close what was happening in China and Wuhan specifically. And we knew that we were going to need to take action, that it was really only going to be a matter of time before we had issues here. So we started very early, which was good. We started to take steps which have continually become more aggressive to really mitigate the effects of COVID-19. And then by mid-March, we sent almost 600 staff from our office into their home work environments. And at that time, we thought maybe we would be back in the office in July, just guessing, but we were also prepared for the long haul. So in July. And what we did early on is we set some very objective criteria by which we would be able to engage our plan to reopen. And we did that in April, so that as time went on, if we got itchy and got anxious to reopen, we would just reflect on that criteria and make the right call. We didn't want to be pressured by ourselves or by others to move. We wanted to set the criteria based on what we thought was smart. So we were going to come back in July. We saw the data. We delayed that to September, mid-September. We saw data then again. We delayed to February at the earliest. And, you know, who knows when we'll be back. Data is going to drive that decision. That's all we're going to really look at. We'll eventually see a lot of changes we'll have to make in work flexibility and workplace structure and anything we need to do to be successful. So we're really just trying to do our best to you know, drive our business forward and keep people safe. We've done a tremendous amount of things in our operations centers to establish new practices, keep people safe. These are facilities where we're essentially obviously shipping product, much of which, you know, has been an incredible demand. Things like freezers, for example, kitchen supplies, food, things like that. Those operations have been very busy, and we obviously have remained open, and we've done a ton to keep people safe. If anybody really wants to engage with our safety teams to get a better idea of what it is we're doing, we're happy to share that just for the benefit of everyone. There's simply not time here, but you know, we've done a lot to try to be successful, and those things have worked. They really have. In 8 months, you know, we have had I'd say 2 instances of person-to-person transmission in our facilities, and that's it. Every other thing that we've dealt with has come from the behavior outside the workplaces. Things that were mentioned before, exposure to family, friends, gatherings, all those things, you know, weddings, Halloween parties, you name it. I mean, that's basically what has driven, you know, the work we've had to do with contact tracing and quarantines and such. So, I mean, obviously we don't live in a bubble. So whatever is going on in the broader community where our employees live eventually becomes an issue that we need to deal with. And keep in mind, we're not just here in Monroe. You know, we're in Missouri. We have multiple facilities in Iowa. We have multiple facilities in Montana. All those things that, you know, we're dealing with really everywhere. So it's pretty complicated. I think fortunately our approaches have kept the bad situation from becoming worse. But the reality is, however the community is faring, that's what we're going to wind up with. Whether we have the best barriers in our workplace or not, people bring their behaviors in from the outside. That's just what they do. So that's why it's so important for the community to really reduce the spread. The healthcare system is really at risk here. And that was my biggest fear last March, is that as the largest employer in the community, if we didn't get our act together, we could bring down the local healthcare system single-handedly by just creating a super spreader situation. And, you know, with Monroe Clinic being the big facility, obviously here in Greene County, you know, we could bring everything crashing down, and we have done everything we can to prevent that. I guess what I will say is that if I would have gotten on a call like this last March, at the end of March, when Wisconsin's 7-day average in new cases stood at 124, and if I would have predicted then that by this time in November, that level would be 35 times higher, and our hospitalization level would be 9 times higher, and our deaths per day would be 14 times higher. And then I would have said that there would be zero coordinated response from the legislature, from the county, or from the city government, and that our schools would be open. You would have thought I had a screw loose if I would have predicted that. But that's exactly what's happened. And, you know, it's affected all of us, and we're trying here to do our best. But we, all of us, have allowed this thing to get this bad without demanding that the people that are really in charge will actually do something about it. And that has made this struggle I don't care which side of the aisle you sit on, that has made this struggle phenomenally more difficult for everybody. So I think that just, you know, the data that was shown earlier, I look at that data multiple times a day. And it's, you know, as much as I probably look at our own income statements, I look at that. And that's really driving everything right now. So, and the scary thing is, if you look at the trend lines in this outbreak and look at where we are, you know, history would tell you that we're headed into the worst part of the curve right now, and really with no real way to stop it in our communities. The positivity rate that was just quoted earlier was, you know, above 26% in Greene County. I think it's in the 30s for the state of Wisconsin. That's incredible. I can remember with my team sitting back here in May and looking at those numbers in Florida that weren't even close to that and going, oh my God, Florida is on fire right now. We're worse. And that, you know, is just really, really challenging. And I cannot imagine that we can't do better. I don't understand it. And the team I have is great at County Brands. We're doing everything we can to keep our business going and to keep the community safe, to keep this from being worse, so we can continue to be a strong contributor to our communities. But whatever mess the community winds up in is eventually going to be our mess. So whether the situation that we're in is a result of freedom or politics or ideology or science is really not my concern. It is what it is, and it's bad, and it's getting worse. And I don't really see any sort of coordinated response, you know, at the state level or at the county level, or even, you know, in our city government to really do anything about it. And I feel like, you know, we're on our own. And if we're on our own, we're on our own. I mean, that's the way it is. We just all have to do our best. But I just would think that we could do better. All I care about at the end of the day is keeping people safe. I care about people's careers, and I care about the families that depend on them in our communities. And I care about all the local businesses that depend on our employees to patronize their shops. And I'm hopeful that together, somehow we can turn this tide and have better luck going forward than we have so far. But it's just going to take a combined effort from everybody. And we have to really try to put our differences aside and try to fix this thing. So that's my perspective. So thank you for listening.
Thank you so much, Bob. We appreciate your perspective and all that you do. I see thank yous coming in the chat. So thank you. With that, I'm going to hand it over to one of Greene County's faith-based leaders, Petter Johansson, to share a bit as well.
Thank you. Yeah, I'm Petter Johansson. I'm pastor at Bethlehem Lutheran Church in Broadhead. And, you know, likewise, there really hasn't been any sort of coordinated effort for faith communities in the county either. We're all kind of doing our own thing. So I can't really speak to what other churches are doing or how they're coming to their decisions. So I thought I would just take some time today to share a little bit about our own decisions as a congregation and how our faith has informed those decisions as we've gone forward. So back in March, our congregation, like a lot of congregations, made the difficult decision to cancel all in-person activities and to start holding all of our services virtually. And so aside from a few monthly outdoor services carefully planned with masks and social distancing, we've kept our building closed and we remain exclusively virtual. I call it a difficult decision because at the heart of what we do and who we are as a community of faith is worship and fellowship and Bible study and community service done together. It's about being together, and keeping our building closed and moving all of this to Zoom and to Facebook seemed almost unthinkable at that time. It's still difficult, and all of us who have stayed the course over these last many months are weary of it. But on the other hand, it really is not a difficult decision at all, because our faith reminds us that it is the right decision. As much as we love being together and as important as our in-person gatherings are, our highest calling is to love God and to love our neighbor. It is to be a community of selfless love that serves one another and serves the world for the sake of healing and hope. Amidst a pandemic, our Christian love looks like this. By avoiding high-risk in-person gatherings, by promoting the wearing of masks and social distancing whenever we are out and among one another, And by listening to and supporting the scientific and the medical leaders in our community, we are loving and caring for our neighbor. We are doing our part as a community of faith for the goodness, the healing, and the hope of the larger communities to which we belong. We also share God's concern for the vulnerable, for the marginalized and the underserved. And from the beginning of this, we knew that COVID-19 has disproportionately affected certain populations more severely, the elderly, indigenous people, and other people of color, for instance. And we know that poverty has a significant impact on access to healthcare as well. And so we need to be considering also how our decisions to gather in person or not, to expose ourselves to risk and thus expose those around us, how it's also a matter of social justice and health equity, things that the gospel compels us to care about and to work for in our life together. I do miss seeing my congregation, and we have experienced loss over these last months. And I long for the day when we can safely gather, but I am confident that we are doing the right thing for our health, for our neighbor, for our communities, and really for the world. I'm confident that on the other side of all of this, we will not regret that we have put our health and the health and well-being of one another above our desire to worship more comfortably. Of course, we still need to support one another, and we need to nurture our spiritual health. This has indeed been a period of terrible loneliness for many people, and I know mental health has suffered during this isolation of the pandemic. And so as churches, we do need to keep exploring ways to stay connected. There's been some wonderful creativity at churches throughout our county to do this, both for worship and pastoral care, and also for community service to those who are hungry and in need of care. And I would urge congregational leaders, clergy, and lay people alike to visit the Wisconsin Council of Churches, that's wichurches.org, for some excellent resources to help navigate the needs of ministry during this time. Of course, we continue to pray for one another and with one another, continue to proclaim the gospel and the hope of our faith. God knows that our world is in need of hope these days. And I want to leave you all with that, with hope. There are voices in the larger religious community that express a different view than what I have today, cautioning against letting fear drive our decisions, that we are people of faith who needn't be afraid of a virus or of death. And I know where they're coming from, and to some extent, I agree with their confidence in God's grace. But keeping apart for the sake of our community health, for the sake of our neighbor, especially those most vulnerable, isn't about being afraid. It's about love, and it's about hope. It's trusting in the promise of God that our actions rooted in faith and grace can make a difference in the suffering of this world. Being aware that our communities and our neighbors are hurting, that our world is hurting, and making decisions to help alleviate and limit that suffering is itself an act of faithfulness carried out in love. It has nothing to do with fear, but everything to do with hope. And it is making a difference, bringing us all closer to a day when this pandemic can be safely put behind us. And finally, I just want to thank you all for the good work that I know you all are doing. And I want you to know that you are in my prayers and you're in the prayers of all the faithful. God bless you.
Thank you. I know it means a lot to hear from our local leaders on COVID-19 and Greene County. The COVID-19 challenge has been going on for a while, and pandemic fatigue is real. I don't know how everyone else is feeling right now, but I'll be totally real. I'm so encouraged by hearing about the awesome leadership we have, and I really do think we're all a community. We can do this together. We have, I'm very excited about this. We have Megan Schiltz joining us today. She's the founder and clinical director of Avenues Counseling in Monroe. She's also a Greene County Leader alumni. And today she's going to share about leadership and mental health and managing pandemic fatigue. So with that, I'm going to hand it over to Megan.
Thank you, Victoria. So I just want to take a minute before I dive into this to just thank Kara and Victoria for the pause and the gratitude, for starting us all out with the pause and the gratitude. And for all of the previous speakers, Jane, Roanne, Bob, Reverend Johnson, for engaging all of us in these important conversations. And I want to express some gratitude to all of you for showing up here and holding this space, specifically to have conversations that sometimes create discomfort, and sometimes create some fear, and sometimes create some anger or frustration. So to be showing up and sitting in this space and allowing yourselves to feel however you feel in reaction to these things, but to still be here and to still be respectful and supportive of one another, I'm very appreciative of being a part of a space like this. I also want to just extend my compassion to everybody for whatever struggles you are carrying with you as part of this ongoing pandemic and everything else that's just kind of compounding and creating fatigue that we're going to be talking about today. So this affects all of us in very different ways. And we'll get into that a little bit as we talk about what compassion fatigue, or I'm sorry, not compassion fatigue, what pandemic fatigue is. But I first just wanted to express, that I empathize and I have deep compassion for everyone and what they're going through and how difficult this is right now. So just a short intro to myself. Victoria gave you my professional role here in Greene County. I was born and raised here in Monroe, and I am now raising my 4 kids here with my husband, who's also from Monroe. And the group, I have a group private therapy or counseling practice in Monroe that Victoria had mentioned. And in addition to providing services like consultation and counseling, we're very passionate about more preventative and proactive care involving community outreach and partnerships, as well as increasing education and awareness about not only mental health, but whole person well-being. And so I will lead into talking about pandemic fatigue with that now. So I'm here to initiate some dialogue around pandemic fatigue, because when we understand its roots, coping with it becomes a little bit easier. So I want to start just by kind of defining the concept of pandemic fatigue and breaking it down a little bit and talking about it from a psychological, physiological, biological perspective. So if we think back to March, when there was a significant shift in our way of being and functioning in our daily lives, we all responded to this by taking on, this full throttle emergency transition. And meanwhile, physiologically, our cortisol levels were skyrocketing to assist us in our response and in meeting the demands of the rapid changes that were happening. We had to adapt very quickly. So we're talking now about the stress response, our stress response, which impacts every part of our whole being. It's biological, physiological, it's psychological. And we're going to look at what's happened now since March in relation to the pandemic and our stress responses. So since that initial amp up in March, our brains, our bodies, continue to work overtime to care for ourselves and for others with no end in sight, and with so much uncertainty that can be very easily overwhelming. So we're still responding to ongoing seat of the pants demands, and we're dealing with the lingering and ongoing physiological and psychological effects of increasing cortisol levels in response to us continuing to manage these demands for living our lives as close to, pre-COVID as possible in terms of going to school, going to work, maintaining relationships that keep us well. So let's add on top of that now all of the additional stressors involving political, social justice, inclusivity issues surrounding us, and then of course our own unique makeups, like temperament, heredity, past and current environment, culture, history of trauma, and early life experiences. All of these things together impact our unique responses and reactions to the pandemic and our capacity for coping with this ongoing stressor. I'm just gonna take a drink. My mouth is a little dry. So the combination of these things amount to what we are calling pandemic fatigue. And I can give you a personal example of like how this could show up in our lives. So for me, and I'm sure I'm not alone in this. So I have 4 small children. I work. I have lots of friendships and relationships to keep up with. Grocery and household shopping for me were very restorative, and it was almost like a respite for me. I enjoyed going to the grocery store. I took my time. Sometimes it was like a half-day event. But it was, it was peaceful. I could allow my mind to wander. I was able to run into people who I enjoyed seeing and talking to, and that social interaction helped me to also, that's very restorative, feels like a respite, feels like a really positive, helpful thing in my life. That has changed now, right, with the pandemic and how everything is going. Now, my shopping trips are not restorative, but they are an actual stressor. So instead of kind of having that reprieve, I have my brain works overtime to think about how to strategize to keep myself safe, to keep other people safe, to plan and organize around how I'm going to get in and get out and, maintain as much distance and feeling, trying to manage my own emotions around feeling anxious or fearful or feeling, the sense of kind of grief or loss or sadness, even for the fact that I will probably be very awkward in social interactions and like wonder like, okay, how close? Okay, I think I need to pretend I don't see them. Or, we're all going through it. I mean, how much work? This is so much work now, right? To do this, to just do this task that I used to have such a sense of safety around that I didn't realize. I kind of took it for granted, right? Because now I don't have that sense of safety when I go to the grocery store. And I don't have that sense of safety when I interact in person socially with people. And I think that's what we're all kind of trying to deal with now. And not to mention, we're all kind of, I think, trying to understand, are they judging us? What are their views on this? Am I doing this the right way? Am I doing this in a way that's putting somebody at risk? Is somebody gonna be mad at me about this? So just trying to figure out, this is our first, right? This is all of us, this is our first, and firsts are messy. And so it's hard to know what's right and what's wrong. And all of our emotions are running high. And so day-to-day things that we used to engage in that were very restorative for us are now stressors. So think about how that compounds. Think about like, I gave you one example of a grocery store trip, but think about day to day. Like, I think it's stressful even to drop my kids off at school now. It's everything's just a little bit harder, and it takes a lot of energy out of us. And so I just invite you to just think about the day-to-day activities that you engage in, your daily lifestyle, excuse me, and what kinds of things that you engaged in, simple things even, that were very restorative, that are now stressful, that you're no longer to engage in, or you're no longer able to engage in. So now, what do we do with that? How do we sustain, and where do we find restoration and respite? Because that's what we need to keep ourselves well. So my perspective on this, and I just invite you all to consider it and consider how it might fit into your perspectives or your lives. We create it by changing our expectations, by rethinking and re-strategizing how we create connection and relationships, and how we maintain those relationships, and how we feel a sense of connection. We are intentional about it. We are persistent. And so maybe that means scheduling these things and having a proactive plan and sticking to it and adding to it. The thing is, this takes this idea of creating opportunities for restoration, creating kind of rethinking and redefining some of the things that we have just always done to be connected to others. That takes creativity and a little bit of innovation. And often when we are in the middle of fatigue, those things are not accessible to us as easily, right? So it it takes a little bit of work in the beginning. But if people are able to sit down and devote a little bit of time to coming up with simple day-to-day activities that already do, or maybe could potentially provide respite, and put those into your daily routine, your or a self-care plan, and having it with you and keeping yourself accountable to sticking to it, maybe having some accountability buddies in it with you. At our place of work here at Avenues Counseling, we have weekly consultations with one another, and that's where we hold our accountability to, hey, how's your self-care plan? Where have you had a hard time following through with things? How can we support you in doing that? So we come together in our Zoom consultations, and those are the types of conversations we're having. I have a few just kind of bullet pointed, maybe, ideas or recommendations I would just throw out there to consider as maybe things that could be restorative for you. But I've also provided three handouts, and I invite you all to take a look at those things and spend some time with them. And one of them, I think you got a self-care wheel, and it talks about all these different domains of our lives and how we can practice self-care in those places. There's tips for self-care, for practicing self-care. And there's also, just for your information, there's a handout about symptoms of stress, or in this case, we can say, pandemic fatigue, stress, they're hand in hand. They're essentially the same thing. So you can use those to guide your self-care planning if it's something you choose to do. But I want to just throw out a few things for you to maybe just consider. And one thing is to make 10 to 20 minutes for yourself to have just a full rest stop to clear any debris, stress, emotional debris, exhaustion, just to clear it. And that means just sitting and letting your mind do whatever it does in that moment. And that's a hard thing for many of us to do, to stop and to sit. Very difficult. And I think there are sometimes some limiting beliefs that can hold us back from doing things like that. And I would encourage people to maybe explore those a little bit in terms of, well, I should be doing something. I can't just sit here. I'm not doing anything. That means I have all these responsibilities. My to-do list is never done. I can't just sit here. This is lazy, right? I mean, we all have different kinds of ideas about what it means to rest and what it means to take care of ourselves. So I would encourage people to kind of examine their own belief systems, and maybe and how those belief systems impact the way you feel and the way you behave or make choices about your lifestyle. Our thoughts, our feelings, our actions are all very, very closely connected. And so just examining those to kind of help yourself through this process of rethinking restoration and self-care and connection during the pandemic. Engaging in simple repetitive tasks can be very regulating and can be very helpful too. So for me, that's coloring. I love to color, and it's just a back and forth motion. And I really don't want to offend. One of my friends has a family member who is in very critical condition right now because of COVID virus, and or the coronavirus. I got her coloring book, and it's a little bit explicit because it has some profanity on it, but it's specifically about COVID, in like basically like, screw this, like this sucks, and it's just a way to kind of vent. Like, you're coloring and you're just kind of like, yep, I'm giving it to the coronavirus right now. I'm giving it to him by coloring in this profanity about how much I hate the situation right now. And then to just let that out and it doesn't mean, I don't want anybody to set up a tent and like take up residence in a place of hate or anger. But sometimes if we feel it and we don't allow it to just be, we don't allow ourselves to just feel what we're feeling, we don't allow it to discharge and we can't move on from it. So I'm saying if you're feeling it, find a way to let yourself feel it that's productive and safe and respectful and responsible, and let it go and move forward into the next moment, and whatever feelings are coming, that's what you're taking on. So just anything repetitive that can that you might just feel some amount of relief or relaxation in doing. An hour, if you can schedule an hour of quality conversation with people you're close to, whether it's just voice call or if it's a Zoom call, that can be incredibly restorative. And I'm not talking about, I'm talking about the quality and the content of that conversation. That's what's going to create connection for us. It's not necessarily about, I don't have to stand face to face with somebody to feel a deep connection with them. I can, based on the content of our conversation and on how I am and my being in that moment, in that conversation with them, that's what determines connection. So, and I think, and my compassion is for people who, I think there are so many people out there who don't know how to, we are, as human beings, our brains are wired for connection. We are always, whether we know it or not, it's on a very subconscious level many times, but we are always looking to connect with other people. We are social beings. We're looking for connection. So this isolation is incredibly difficult and detrimental. And that's why I'm saying we need creativity and innovation to rethink how to make connection happen without putting people's health at risk and spreading this virus beyond what it's all, beyond the damage that it's already done. So gratitude I wanted to bring up. So Kara, thank you so much. I loved your gratitude tree. I mean, how easy would it be to just fill out 1 or 2 sticky notes and stick it on a tree in your house each day? So research does show we can rewire our brains, which means we rewire the way we think and feel and behave in the world, in relationships, within ourselves, by simply spending even 5 minutes a day thinking about things that we're grateful for, and somehow, like Kara said, somehow externalizing that. I don't care if you journal it with a bullet point. I don't care if you, if you're a creative person and you doodle what you're grateful for, or if you just have a conversation with somebody close to you about what you're grateful for that day, and you hold each other accountable for having that conversation each day. Those things can be very, very helpful, and they can be very protective in terms of helping us manage and get through adversity. Making or sending someone a card or a greeting, something that makes somebody else feel good, can also be very helpful for us. Mindfulness practices, if you're familiar with mindfulness practices, I don't have time to like get into details on things, but I'm very open to people reaching out and contacting me via email for any resources or any further information on anything I've talked about today. I will provide my email in the chat box before the end. But practicing mindfulness and maybe talking with your physician about your vitamin D levels. This is kind of like on a more physiological, biological level. You might want to check, especially time of year, right? So checking on vitamin D levels and making sure that that is something you're not short on, as well as light therapy. I don't know if anybody has any experience with using a little light box that can be very helpful in times of seasonal, where we have less sunlight, it's colder out, we're not getting outside as much. So light therapy can also be a very simple non-medication way to help ourselves in the midst of this pandemic as well. And I'm happy, as I said, the light therapy boxes are, I have one, I keep looking this way because I have one right there and I'm like thinking you can all see it. You can't. You know, this virtual thing, you'd think I'd be used to it, but I'm not. So light boxes are so easy to access on Amazon, you know, and they're fairly affordable now. Walmart, I think, has some light boxes there, I've been told. So they're pretty easy to access. But again, anybody is welcome to reach out to me for any further information. And especially if you are kind of using the handouts I provided and trying to create your own kind of proactive self-care plan, please reach out to me if you have any questions or need any help with doing any of that. And thank you again all so much for being here, for holding space, and for joining in this conversation that's so important for our community.
Awesome. Thank you so much, Megan. Huge thank you, everybody, for joining us today. I know there's a lot we just went over. We heard from so many amazing leaders, and there's so much going on. And I think it's a good reminder that if we each do what we can each do, we can really make a positive impact in the sort of fight to get the rates down. Huge shout out to everybody who's thinking of different ways that we can improve in doing things better together, even when it's physically distanced. Again, I know there are a lot of comments and great questions in the chat. We will definitely follow up on that via email. So again, in September, we intentionally explored how to focus on our own circle of control and understanding our circle of influence. We looked at how to support our communities. In October, we focused on building skills to be focused, grounded, and civil. Today, we looked at how we can decrease COVID-19 rates and promote health. And we hope you can join us for our next session, Wednesday, December 9, where we will focus on health and wellness. We will follow up this session with an email next week with additional resources information that'll also be shared on our website. So thank you so much for everything. We hope you have a wonderful rest of your day. Please stay safe.